My name is Dr. Ajaz Chaudhry, and I'm an otolaryngologist here at Northeast Atlanta Ear, Nose, and Throat. I am board certified in otolaryngology and head and neck surgery, and I treat patients of all ages, including children all the way to adulthood. I'm originally from Indiana, outside of Chicago. I went to undergraduate at Loyola University in Chicago. I then went on to do my medical school at Indiana University. My training in ear, nose, and throat surgery was performed at one of the busiest centers in the world at the University of Alabama in Birmingham. I was lucky enough to serve as chief both at the children's and adult hospitals there, and had the privilege of taking care of thousands of patients throughout 5 years of my training.
I'm Dr. Jeff Roth. I've been with Northeast Atlanta ENT for 21 years now. I started with the practice in 1996. My medical training began at the State University of New York at Syracuse, which is now referred to as SUNY Upstate, and I spent 4 years there. And then I went on to do my medical training at the University of Miami in Miami, Florida. And as part of my residency training, then during the 5 years I spent, at the very end of it, I spent 4 months in Cambridge, England, to do a mini fellowship where I was able to work with an ear surgeon in Cambridge, and I gained some very valuable experience there.
Ear, nose, and throat is a very unique specialty. It's a small specialty, but what really makes us unique is we work on so many things that affect the quality of our patients' lives. We work on the senses, things that really make us human. The ability to smell, taste, speak, hear, those are all the things that we use to interact with the world, and that's what makes our specialty quite unique.
Well, I think I found ENT, and perhaps it found me. I thought pretty early on that I was very interested in surgery, as each time I went into surgery I found it pretty fascinating. And then as I made my way through some of the surgical subspecialties and even general surgery, I realized that ENT surgery was probably most interesting to me from an anatomy perspective. I did like ophthalmology as well, because of the sense idea. I was always drawn to that, the idea of working on the senses, but ophthalmology just seemed like such a small field, just one little eyeball, and ENT gave me much more. It gave me the senses, the hearing, but also an opportunity to work on patients with head and neck surgery, and also the ability to see patients of a very wide age range, and both men and women. So I wasn't limiting myself in any way, and I thought that was important to me. I wasn't sure what segment of the population I really wanted to work with, and ENT really satisfied everything for me.
There are many symptoms of sinonasal disorders, the chief among them being inability to breathe or smell through our nose, facial pain or pressure, postnasal drip or discharge, and headaches. We also deal with patients with recurrent sinus infections. You're having to go to your primary care doctor multiple times to get antibiotics at different times of the year. Those are all signs of underlying chronic sinus issues or chronic sinus disease. The ability to breathe, smell, and taste affects the quality of our life. Patients with chronic sinus disease have many of these symptoms, and if left untreated over time, it can result in worsening symptoms, progression of their pain or pressure, infections that go on to other parts, including the eye or the brain. So it is something, if it's occurring in a relatively regular fashion or progressing, needs an ear, nose, and throat evaluation.
So we are very fortunate to have a CAT scanner in our office. Our CAT scanner is a cone beam scanner, which really reduces the amount of radiation that the patient is exposed to. In fact, when you get a CAT scan of your sinuses with a cone beam scanner, it's 1/10 the radiation of the traditional circular scanner. So you're talking about 10% of the total radiation in a cone beam sinus CAT scan that you would get, say, in the CAT scanner in the hospital. So we're very fortunate to have the cone beam scanner. It provides amazing images. It allows us to get information about patients with sinus disease that you cannot possibly get in any part of your examination. So the CAT scan is often a critical piece to determining what's the level of sinus disease, or is there significant sinus disease? It's an incredibly important tool to the physician. And to be able to have one in the office means when we bring a patient back for a scan on the very same day, we can review it. So the patient's not going to multiple locations. And that's so important, as we all know. We're all time pressed. Time is one of our most important commodities in all of our lives. We're always looking for more. And so to be able to come to a single doctor visit, have your examination by CAT scan, and then review it with the doctor, right at the same day, it's probably one of the best things that we've had happen to our practice in terms of incorporating CT technology. Really great for the doctor and great for the patient. And often for many patients, they come in with sinus complaints and they may or may not have sinusitis. They have a strong history. They've probably been aggressively treated medically. So the CAT scan becomes the key piece in determining, where is this patient? What's the disease really look like? There's no other way to open the sinuses. There's no other window that's quite the same. The great thing about the ability to be able to do a CT scan of the sinuses here in the office is that our cost is so much lower than if you were to have it at an outpatient facility or even a hospital. Of course, the hospital would be the most expensive. The outpatient facility is still more than our in-office scanner. So what's happening is many times patients have very high deductibles, but the cost of an in-office CT will be a fraction of either the cost of a hospital CT or an outpatient CT. So if the cost is going to a patient's deductible and the patient is having to pick up the entire cost, the CT scan here will be only a few $100s, and it'll be much, much less costly than if they were to have it at the hospital or an outpatient facility. So it's another great advantage of having this in-office scanner. After many years of treating patients with hearing loss, it's interesting to me that when patients present, it always seems a little different to me. I think sometimes even a patient with relatively significant hearing loss may not present saying or bringing forward their hearing loss. And I've always found that interesting. Many people even try to hide that fact, or perhaps work so hard to compensate for it that they're not certain what their hearing really is or how bad it might be. But I think the main piece about treating hearing loss is really that it's so rewarding, because in terms of functionality, I think people underestimate the importance of hearing. Even in daily life, it's something we very much take for granted. I always found it really extraordinary that, and this is very true, that Helen Keller, who was both blind and deaf, was asked if she could restore one of those two senses, which would it be? And I think most people are very surprised that her answer was hearing. But loss of hearing can really marginalize a patient socially. It's very hard to participate in things when you don't hear. And it's very sad. And I think many people don't realize from a social perspective the harm that it may be doing. So I think sometimes hearing loss can be difficult to pick up. We have the best possible tool here in that we have a doctor of audiology testing patients.
Sometimes they might come in for sinus or allergy and not realize they can evaluate their hearing, and they may have had some balance issues that have been intermittent over the years. So if they need audiology testing or treatment, we're here and we're a great part of the practice. And people are happy they don't have to go and piecemeal their care out and find providers.
So we obtain the most accurate information regarding a patient's hearing. And once we have that information, we can give them great counsel. There are many surgeries that we do in this practice with respect to ear disease and hearing. Some of them are repairing an eardrum, so that'd be a relatively straightforward surgery. We take care of patients with cholesteatomas, which is more of a chronic ear disease problem and may even result in mastoid surgery. We also take care of patients with otosclerosis and perform stapes surgery using a carbon dioxide laser and some very small implants to restore hearing. So we do a very wide variety of ear surgery here, and of course, even myringotomy tubes in children where we drain fluid from the ear. And in an adult, we can perform that procedure here in the office. So we do a very, very wide range of ear surgery in our practice, and that just touches on a few of the things we do.
Our goal with any patient with chronic rhinosinusitis or chronic sinus disease is to make them well. Our first goal is to make them well by using medical management, using a combination of treatments that allow the inflammation to go down, the infection to resolve itself. To that end, we have the ability to perform procedures in the office, to perform cultures, to look further in the nose than your primary care doctor can, to give us a better diagnostic understanding. Now, for those patients that are unable to be improved by medical treatment, we have the ability to perform a full array of procedural or surgical management. These may include in-office procedures such as a balloon sinuplasty, which allows us to open the sinuses in a minimally invasive fashion right here in our office without the use of general anesthesia or a hospital. This allows the patients for a quicker recovery, a shorter procedure, and allowing them to get back to their work or life faster. For some patients, it may require a procedure in the hospital called an endoscopic sinus surgery. This is also a minimally invasive operation performed entirely through the nose using cameras and scopes, allowing us to open the sinuses in a more formal fashion, allowing infections and disease to be treated and cure that patient for a more longer-term basis. To this end, we have sinus experts here in our practice. I have done extensive training in endoscopic sinus surgery and balloon sinuplasty, and I have performed hundreds of these procedures, both at the hospital and in our office. I was trained by one of the world leaders in endoscopic sinus surgery at University of Alabama in Birmingham. I'm also an expert in providing approaches to the cranial base, so I work with our neurosurgery colleagues to go through the nose to perform endoscopic surgery on the pituitary gland, and having done these more complicated procedures allows me a better understanding of treating the chronic sinus disease, which is more common. The most unique thing about our practice here at Northeast Atlanta Ear, Nose, and Throat is the culture of caring that we've embraced here. This is a team-based approach to providing care for our patients from all aspects of their health, starting from the phone call all the way to the physician treatment, whether it be medical or surgical. I think most patients want a compassionate, carefully thought out care delivered in a way that they can understand. And we really believe in that here at our practice. We care about what we do. We love making people feel better. When patients walk in our doors, we know we're here to serve them. We're here to fix their medical illness and do it in the best possible way. And patients leave here feeling that, and they come back. Being a physician is a very special responsibility. When someone walks in the door, they're trusting you with their illness. They're coming to you with a problem that they may not tell anyone else about, and we take that responsibility and we take it very seriously. And I hope that's our legacy, in that we provide care for patients with the utmost respect and to the best of our abilities. The most satisfying part of my job is being able to tell a patient that they're healed. We deal with a large variety of illnesses, including malignancies, and being able to look at in the patient's eye or being able to look at their family, one, to tell them that they will be fixed, and then eventually to be able to confirm that by saying that their illness has been cured and they can go on and live their life as they had once planned, is my greatest reward.
My name is Heather Anderson, and I'm one of Dr. Chaudhry's patients. When I first met Dr. Chaudhry, I had had a very bad sinus infection that actually infected my entire eye. Nobody really knew what was wrong with me. I showed him the picture that I took after going to the emergency room. He instantly knew what it was and sent me in for a CT scan. After reading the CT scan, it was very clear that I had sinus disease, and the next step was to have sinus surgery. I had the surgery done in Emory Johns Creek Hospital and under Dr. Chaudhry's care. After having such a great experience with Dr. Chaudhry in the practice, my kids have been seeing Dr. Chaudhry as well. We have the whole family in the practice, and as a mom, you want your kids to have the best care, and he is so friendly and welcoming and puts them at ease, and I hear him with his other patients, and he just genuinely has fun with them and really enjoys the patient interaction, which I think is very unique.
What I strive to be as a physician is someone who will care for patients as if they were caring for family members. That's something I think about a lot when someone walks through the door here. They're giving up their time to come and see me. We're all very busy. Regardless of the person, our lives are hectic. So if someone's taking the time to come and see me, I'm hopefully going to give them the very best I can, give them all of me. So when they leave, they've been well cared for, and I've given them 110%. And I think that does distinguish our practice. I think it's a philosophy. I think it's something we strive to be. I think, this is not a place where we try to move the most amount of patients through. This is a place where we try to give excellent service. And I think we're doing a pretty good job. With respect to patient satisfaction, that's something that's on our mind all the time. We don't want a single patient to leave here who's unsatisfied, but I think we make sure that in our visit we have an opportunity, and I end each of my visits making sure that a patient's able to ask me any questions that they want and express any issues that they may have had with the visit. So I think that's a very important part of any physician visit, to make sure that the patient is happy and make sure that the patient's had an opportunity to fully express themselves and let us know any of their concerns. I think our goal at Northeast Atlanta ENT is really relatively simple, and I don't think it's changed at all in the 21 years I've been here. Our goal is to provide the best patient care that we can. I think we talk about a culture here, and it's a culture we've been trying to establish, and we talk about it not just amongst doctors, not just amongst audiologists or physician's assistants, but amongst every employee here, that what we want to bring is an experience where a patient's perfectly comfortable.
My name is Kevin Balgobin. I'm a patient for about 4 months now with Dr. Roth. So my story basically started with me being referred by my primary physician to another practice, and the experience there wasn't the greatest in the world, so a friend of the family referred me to Dr. Roth. And from day one, the experience has been amazing. The staff here has been amazing. Dr. Roth has been amazing. He's even seen me off hours at this office late in the night because I had some issues, and he brought me in and saw me that evening, so it's been absolutely fantastic. The patient interaction was fantastic. Dr. Roth took the time to really diagnose my issue, kind of figure out what I do for a living and how it affects my day-to-day life. The staff is the same thing as well. They took the time, it wasn't rushed, and they came to a conclusion through a series of visits and ultimately treated my ailment. I would refer somebody to this office because the staff and the doctors are absolutely amazing. They truly want to know what your issue is and find the root cause the most expedient way, and they listen to you. I went from a pincushion to a patient that they ultimately cured my ailment within a few weeks.
Jeffrey Roth. I've been with Northeast Atlanta ENT for 23 years. We are a general ear, nose, and throat practice. We do specialize in certain areas of ENT, but we try to provide service in all aspects of ENT. Northeast Atlanta ENT is a very family, patient-oriented place. I think we really concentrate on making patients feel comfortable here. Dr. Chaudhry, who really has developed an incredible expertise in minimally invasive sinus surgery while maintaining his expertise in head and neck cancer surgery. And then we have Dr. Gaurav, who is supremely trained in otology, allowing us to really provide a wide range of both surgical and medical treatment for ear disease. Couple that with Dr. Carmichael's background in sleep, and then all of us having some solid training in pediatrics, we really are able to care for patients from birth to old age. We're experiencing a boom in technology with respect to the things that we now do, and changed very much over 23 years. Basically, medicine's becoming less invasive, and we see many more minimally invasive techniques, and we see technology impacting us in every aspect of practice, start to finish. I mean, be it EMR or hearing aid technologies. The biggest thing that's happened to our practice is the ability to offer minimally invasive surgery here in the office. Skip going to the operating room, no general anesthesia for many of our procedures now, where we can keep a patient very comfortable here in the office and complete a minimally invasive surgery where patients have much less time off from work, much less recovery time, much less pain. So we've really seen that shift, and I think it's continuing. And I think technology has really allowed this to happen. We basically have a mini operating suite here with all the technology required. That's been a great change in 23 years. In my practice, many of the things we used to take a patient to the operating room for, we can now easily take care of here in the office. We're really proud of the fact that we have so many long-term employees. As our group, such a large percentage of people have been here more than 10 years. And I think that affects patient care more than we often appreciate. As I see patients check out and they know the people who work here by first name, and it's a really friendly relationship. So there's a connection there. And I think it helps our patients feel comfortable. I think we are running an office that is very, very personable and very interested in personal care. There is nothing sterile about us. There is nothing unfriendly. We really are trying and striving to make this a very comfortable experience, that every experience feels like it's okay. Like it's not a scary thing. It's not an intimidating thing. We want it to be a personal thing and a welcoming place. And that's what our long-term employees have helped us really provide. We understand that impact, and all we want for our patients is to have optimal results and have a great experience. And that's really what we're striving for. It's the experience. It's the result and the experience. That's what we want. We want patients to come here, feel very comfortable, and get the best possible care.
Ravi Gaurav. I've been practicing since 15 years. I graduated from Yale School of Medicine, residency here in the US. My specialty is more into doing ear surgeries. I used to do a lot of plastic as well, facial plastic surgeries, and also sinus surgeries, balloon sinuplasties, and also skin cancers. Well, in a medical school, we were not sure which specialty to pick in. One of my friend had some deafness. He couldn't hear. At that time, his deafness came from a family history. He was diagnosed as otosclerosis, which is a bone fixation in one of the inner ear. So he went and had an operation by someone who came from Europe. He did put a little tiny prosthesis in. And that threw me off completely because he came back with completely normal hearing. I was blown away. Wow, that's a specialty I would love to be in. We sees about 20-25 patients a day. And also we see all sort of ear disease, chronic ears, hearing loss, We have all specialties in one place, and we all expertise, we all train in different aspects of our career, so we can give utmost state-of-art surgical skills that we can offer them. Patients here will come in, and the staff is excellent. I think they'll feel more homely and friendly here. I did all kinds of specialties in part of ENT. I love to do otology, which helps the people hear better, because I see from pediatric to adult populations. At the same time, I also do some sort of a facioplastic surgeries as well to improve the facial aesthetics on patients. Coming from a foreign medical graduate, it was just tough to get into ENT slot, so I had to do a fellowship in Manhattan Near Hospital, do a lot of writing and reading, journals, presentations, and then I got an opportunity to do residency at Yale University School of Medicine. Phenomenally, I think when we can help people to hear better and the quality of life improves, it changes our life as well. We feel it's worth our hard work and all that late hours of reading, studying, and trying to learn the skills of doing surgeries. And finally, you can see you can help the patients in the long term. When they come with a problem, we can solve the problem with great dignity. And I want patients to leave with this Northeast Atlanta with such a great pride in themselves.
Matthew Carmichael. My specialty is otolaryngology, head and neck surgery. Another name for it is ear, nose, and throat doctor. I've been practicing for a little bit over 5 years at this point. Where I went to medical school, there was not an ENT residency program. So what I did was I got hooked up with a local ENT private group, and that happened probably midway through my 3rd year of medical school. And the first surgery I saw with them was a cochlear implant, which was one of the coolest things I've ever seen. And I actually followed the patient when they got their cochlear implant turned on. It's the first time the kid ever heard. So it just, at that point, I was just like, wow, this has got to be something pretty neat in medicine. So I did more research into exactly the specialty and figured out that it was for me. And then the other thing is that you see people from basically birth, or even preemies, to 90-year-old people. And I can see that entire spectrum, and I can pick and choose things that I like. There's so many different subspecialties off of ENT, and everybody kind of gravitates into one of them. So on a day-to-day basis in the office, patients will come in. I get to interact with them, which is one of my favorite things to do. Medicine is one thing. People come in with complaints. They've some sort of an issue, but the honest truth is that I like to get to know them. I like to talk with them. On a day-to-day basis, my biggest goal is to at least make a connection with a patient, and hopefully there's something that I can do to help them. And that's my goal on each and every day. Obviously, I don't know all the different practices out there, but one thing I do know about our practice is that each individual doctor and provider that we have gives exceptional care. We're all nice people, and we're gonna be honest with you about whatever's going on. And we're gonna do our best to help you. If there's something that we can't help you with, then we'll send you to a person that we know that we trust with your care. I want to treat patients like they're my family. That's my philosophy. It's when I talk with you, we're talking as mutual people. In other words, when we make a decision, it's a mutual decision. It's not me telling you this is what we're going to do. It's a conversation. That's what I want people to take away.
My name is Paige Pronte, and I met Dr. Carmichael about 3 months ago. I was sent here on an urgent basis from my primary physician. I had some lymph nodes that swelled tremendously in my neck, and my primary doctor, I think, thought some really bad things. So I was sent here. Dr. Carmichael was nice enough to fit me in. That day I came straight from the other office. I was very upset. as anybody would be, and I was scared. His sense of urgency and his sense of compassion and his knowledge helped me calm down. And through testing and his ability to look at the situation, we did find out that it wasn't what the most scary outcome could have been. It did turn out well, but I would absolutely have my friends, my family, anybody come see Dr. Carmichael. And I was definitely embraced when I got here. They got me right back. It's just a very caring environment. That same compassion would be given to anybody. I'm positive of that. He's very thorough. I'm sure the other doctors are as well. It's just a great place to be. You feel like you're being taken care of, that nothing's being missed. It's just all around a positive experience. You have to face it. As scary as it is, you don't know what you're fighting until you know what it is. It may not turn out to be what it appears to be in the beginning. I mean, I'll go ahead and say it. I think lymphoma was what they were concerned about. And obviously that is beyond frightening. His compassion was exactly what I needed that day. I don't want to say take charge because that sounds a little aggressive, but when you're in that situation and you're in that mental state, that's what you need. You need somebody to take charge that knows what needs to happen and what tests need to be done. And, you know, when they can have that take charge attitude with the bedside manner that he has, it's the full package.
My name is Linda Bryant, and I've been coming to this facility for 3 years. For a long while, I've been experiencing a lot of allergy and bronchial issues. And it dawned on me that perhaps I need to get some allergy testing to see, in fact, what is going on, what I'm allergic to, because I've been going on for many years. I come in, they always greet me by name. How are you doing, so on. Ashley, my tech, very friendly, very attentive to making sure that I'm comfortable. One of the things I typically receive after a shot is a little medicine so it doesn't itch so much. And she's very attentive to that, knows that I want that. So everybody's just responsive to what my needs are, making sure that I'm okay. One of the things I do remember is when I first started getting the shots, they would follow up with me to make sure that I was feeling good after the shots, because they know after the first time, it's like, okay, the body, they don't know how my body's gonna respond. So they followed up, are you okay? Do you have any symptoms? So on and so forth. So that made me feel real good. I would certainly recommend this facility, and I would say get tested, because if you have any kind of allergy symptoms that are just bothering you and you really can't function well, get tested, and then follow through on whatever recommendations you're given.
My name is Stuart McClymans. I first saw Dr. Roth, must be 10 plus years ago. Had recurrent ear infections, and he solved that problem. I most recently began seeing him, I guess it was late 2017. I've had seasonal allergies most of my life, and in late 2017 became really, really bad. So I came back and saw Dr. Roth again. He began treatment. Most recently, I guess mid-October, he performed a sinus surgery on me, and I am like a new person. Been able to breathe again for the first time in years and years and years. I had surgery on Wednesday, came home that afternoon. A little bit of soreness for 3 or 4 days. I would say by next Tuesday, I was probably back up to about 90% of myself, and that's been about 60 days ago. And really the recovery has really been just painless. I've had interactions with any number of the staff here, and always been very helpful, very accommodating. Even after hours, I've been able to get through to a doctor if I've needed to, and I've needed to on a couple of times in the last year. I can't say that you ever look forward to going to the doctor, but you know, Dr. Roth is he's just a great guy. I wouldn't hesitate to recommend Dr. Roth and his entire staff. It's been just a tremendous experience. They've managed to solve a problem which has plagued me for years, and I got to say, it's just been great.
My name is Ajaz Chaudhry. I'm an otolaryngologist specializing in the treatment of disease of the ear, nose, and throat. I've been in practice here at Northeast Atlanta ENT now since 2014. You know, what's truly unique about our practice is a comprehensive approach to the care and treatment of sinonasal and allergy diseases. What I mean by that is we have truly built a center of care. We have the ability to properly diagnose patients with technology such as endoscopy, which allows us to look inside the nose and sinuses. We can then, if need be, obtain a CT scan right here in our office the same day and share those results with the patients. Following that, the patients can be treated with a variety of options, medical therapy, allergy treatment and testing also done in our office here, and also, if need be, procedural options. Even within the procedure options, we have a full range of treatments from minimally invasive in-the-office procedures lasting a handful of minutes to in the operating room sinus surgeries, which we do routinely and in this practice have done over 5,000 of them safely. So it's this truly unique approach that allows us to take a single problem for our patients and offer a complete solution from A to Z without sending them outside of these doors that makes us a special practice. Each of the surgeons within the practice has their own subspecialty and their own extra training. For example, we have surgeons that specialize in more cosmetic parts of ENT. We also have surgeons within the practice that do ear diseases and hearing loss surgery, sinus disease and sinonasal surgery. We are able to treat head and neck cancers such as thyroid cancer, facial cancer, even skin cancer. So really, ENT is a wide specialty. It encompasses everything, we always say, from skull base to clavicle. So essentially we take care of diseases of whatever lives in those areas, including the voice box, all the senses that make us human, speaking, swallowing, talking. Given its wide breadth of the nature of our specialty, we have multiple doctors with extra training in all those fields, allowing us to deliver comprehensive care. Our main goal for our patients is to truly feel like they're compassionately and completely cared for. We want them to feel like they can ask their doctors all of their questions, that they're given the appropriate time and the appropriate respect for each illness. I specialize in surgery and I do hundreds of surgeries a year. But each time I remind myself that to that person, it's the only surgery that matters. Whether it be something small or something very big, it's very big for that family. So as I wash my hands before that case, I remind myself this is the only case that matters.
My name is Linda Lee, and I have been coming to Northeast Atlanta Ear, Nose, and Throat for actually just a few months now. A few months ago, I found out that I needed to have quite a complex surgery done in my neck region. So I sought out to try to find a skilled surgeon who could accomplish this. And that's why I decided to come in and meet Dr. Chaudhry to see if he was the right surgeon for me. Actually, from the first visit, when I came to see Dr. Chaudhry, I felt completely at ease with him. He went over my case thoroughly with me. I'm a physician as well, and so I could tell right away that he was competent, he was skilled, he had enough experience to do the job. So that's how I chose him. I felt very comfortable with Dr. Chaudhry. He explained step by step what he was going to do, what I should expect from the whole procedure, and I had a great outcome as a result of that. There were risks to the surgery, and he explained all those to me. It's only been like a month actually since my surgery, so everything has been great. I'm just very grateful that I found such a skilled surgeon. I feel that Dr. Chaudhry has all the aspects of a good physician and surgeon. He's caring, he had a great bedside manner, and competent. I would highly recommend Dr. Chaudhry if you have to have some type of surgery pertaining to the head or neck. This is what they specialize in, and I feel he is extremely competent in what he does.
Well, most of the people we see here with ear pain, ear discharge, dizziness, hearing loss, most of the time they don't know whether it's coming from the outer ear or the middle ear or inner ear. So then we got to make a diagnosis by asking more questions. If it's just an outer ear, most of the time it's usually fungal infections or swimmer's ears, very common, which can be treated by medications. And the other causes are in pediatric populations, usually chronic ear disease. They will have a lot of ear infections treated by the primary doctors that come in here to get resolved. We advocate PE tubes, which is the ventilating tubes to help that ear infections to settle down. The other causes people do come in, they don't even have a drum. They come back here hearing loss and you look at it, they don't have eardrum. So then the question comes for us is it'll help us to graft the eardrum. Those will improve hearing, and then if there are older populations, helps them to wear hearing aid as well. Sometimes you will see hearing loss secondary to bone fixations, like otosclerosis. It's a unique condition where stapes completely get fixed. We may have to put a prosthesis or piston to help hearing. In addition, we also do bone anchoring hearing aids, where people cannot do a proper ear surgery, so we can implant the bone hearing aids that'll help the hearing as well. Those are the main 80% of our ear disease that we see. Very small percentage, you'll see tumors in the ear, very rare, but you see glomus tumors, acoustic tumors also. Those are diagnosed with CAT scan and other imaging studies to further evaluate those patients and further manage. A lot of patients that I see have TMJ. They grind their teeth and the ear hurts and they're all referred pain. Or even they can have a tumor or infection in the tonsils, the ear can hurt. Those are things that I see most of the time when the people come just for ear pain and everything looks normal. Your eardrum looks normal, there's no discharge, and they're not dizzy. Those are the ones I think you got to figure out where the pain's coming from. Come in, we'll examine the patient, we'll see where the trouble is, we will navigate their ear pains, and we will help them so that they don't suffer from ear pain.